this suggestion that we think and act like a movement. It shouldn't detract us from, the day-to-day work that we have to do or that we want to do with the issues that we're associated with. But I wonder if you could just briefly identify, because you've already mentioned some of these, like the World Health Organization's baby-friendly hospital. But I know that there are now lactation consultants. There are, of course, academics. There are many, many, many other players who don't belong to La Leche, but who are part of this broader movement. Could you just identify some of them, because it strikes me that you've become the grandmother of all of those as well. Who else is in your movement that you?
Well, it was actually La Leche leaders who started the whole lactation consultant form. And when they began to get to the point where they were going to have an exam and get really official, we actually loaned them the money in order to do this, because we recognized that there was going to be a need for paid professionals who could be in hospitals or be part of doctors' practices, and we didn't want there to be a division, a polarization of the ones who were volunteers and who weren't paid, and the ones who were paid in order to help mothers, so who had a profession that would pay them money. So we tried, the whole idea in the beginning was working together as much as possible. Sometimes that doesn't work as well as we'd like it to, but it's something we continually work at, keeping the connection, the communications open between those two volunteer and paid professional occupations helping breastfeeding mothers. We're all trying to do the right thing. We all want mothers to succeed, and I think the more we can work together, the better that will be. I was just, well, in the United States, we have what's called the United States Breastfeeding Committee, and that's a coalition of about 70 organizations and agencies that in some way touch breastfeeding. And they meet together in Washington, D.C., and the whole idea is, how do we, through our many pathways, make sure that breastfeeding isn't being harmed by what we do? And this is Leche was a core partner in getting this started too, and it's a very advantageous and important group because of the many, many agencies that they are part of, so who are all very conscious of breastfeeding, because you can be tripped up in breastfeeding in so many ways right now, often in the United States, because we have such short maternity leaves, and some women might have no maternity leave at all. This is going to create a problem when you're starting out breastfeeding your baby, and you really need a lot of time to get to know that baby and its breastfeeding patterns. So you want everybody to understand. The mother who's nursing in public, instead of somebody getting upset because she has to do it, should really be going up and patting her on the back and saying thank you, because her breastfeeding is impacting all of us, no matter where in the world she lives. There's not the footprint that formula brings into the world. You're just direct from the provider to the baby who's getting the milk. And of course that baby's going to be healthier, which means there's going to be less money put out from our taxes to help support that baby in the hospital. In fact, there have been a number of studies done in the United States to show how many millions of dollars would be saved if every mother was able and wanted to breastfeed her baby for the first 6 months of life. Which makes me realize I hadn't mentioned, In the Leche from the beginning, we have not been out to force or even try to convince women to breastfeed their babies. We're there to help the mothers who want to breastfeed. That's
Yeah.
been what we did from the beginning. But we also promote a better understanding of the value of breastfeeding so that the culture will give support to that mother and not make it more difficult for her.